Good evening, ladies and gentlemen. I'm Indrani Malkani, Chairman and Managing Trustee of V Citizen Action Network, and I extend a warm welcome to all of you on behalf of VCAN, which is V Citizen Action Network, and our Municipal Corporation of Greater Mumbai, for joining us in our fully digital social Sanchar. In the month of June, on 30th, Mr. Kakani, our additional municipal commissioner, had joined us to interact and discuss issues regarding the pandemic that is all over the world. He was supposed to join us this evening as well, but as it's wont to happen with the government, he has been called for an urgent meeting, for which reason he is not able to join us at this moment. But standing in for him, we have the privilege of welcoming Dr. Hemant Deshmukh, the Dean of KEM Hospital, and our very competent and enthusiastic Deputy Executive Health Officer of the MCGM, Dr. Daksha Shah. We are privileged to have Professor Gautam Sen, member of the Board of Governors, National Health System Resource Center, a technical arm of the Government of India, with us as well. A little bit about VCAN. VCAN is a registered public trust, and all donations are exempt under Section 80G of the Income Tax Act. VCAN's overarching objective is to establish linkages between the citizens and the government authorities, and we work in the spirit of partnership with several of the government agencies. Our focus area of work includes aspects of health, air pollution, road safety, fire safety, waste management, electoral processes, etc. All in all the things that each one of us as individuals are connected to. Recognizing some of the basic challenges that citizens face in their daily lives, we launched our interactive web portal, TogetherVCAN.in, where in a single platform, we address multiple issues. Realizing that we needed to do a lot more to make this interaction with the government agencies more robust, we launched our interactive live talk shows titled Together We Can's Social Sanchar, with the motto, interact with the government wherever we are. Actually, that is what it was, wherever you are, but in today's current times, it has to be changed to wherever all of us are. In this particular social Sanchar, I would like to specially thank our well-being and healthcare partner, HealthSpring, for supporting this social Sanchar. I would like to specially thank our team Technolegion for powering this version of the social Sanchar, and for always being vigilant and keeping our web portal going. I also thank Mr. Sumit Shah, our consultant, Sumit Lula, our consultant for social media. And I am delighted to thank the student volunteers of Jai Hind College, our collaborating college partner. May I now request my fellow trustee, Mr. V. Ranganathan, to introduce our guest speakers, Professor Gautam Sen, Dr. Hemant Deshmukh, and Dr. Daksha Shah. May I also say that Mr. Ranganathan was our former municipal commissioner and has also led the state of Maharashtra as the chief secretary. Mr. Ranganathan, may I request you to first introduce Dr. Hemant Deshmukh and Dr. Daksha Shah, and thereafter Professor Gautam Sen.
Good evening. I have great pleasure in welcoming Dr. Hemant Deshmukh, Dean of KM Hospital and GS Medical College, to this online social Sanchar. He is a renowned doctor who has specialized in interventional radiology and also in peripheral cardiology. And the last time when I met him was when he was felicitated for public service by the Junior Chamber of Commerce. We look forward to his expert guidance during this session of Social Sanchar. Accompanying Dr. Deshmukh is Dr. Daksha Shah, Deputy Executive Health Officer in BMC. She is a postgraduate in public health and Masters in Health Leadership, Masters in Public Health and Health Leadership program from McGill University. She is also a Fulbright scholar. We look forward to her presentation during the social Sanchar. And last but not the least, it is a privilege to welcome Dr. Professor Gautam Sen, who is an eminent medical academician and surgeon. Professor Gautam Sen has practiced surgery for over 4 decades. He is a member of the Board of Governors of the National Health Systems Resource Center of the Government of India and is the founder chairman of Wellspring Healthcare. He had the honor to be a member of the first Board of Governors of Medical Council of India, and he has participated in numerous committees of the Ministry of Health, Government of India. Professor Gautam Sen is a fellow of the Royal College of Surgeons of Edinburgh and a fellow of the Royal College of Physicians and Surgeons in Glasgow. He was awarded the Millennium Gold Medal of the Royal College of Surgeons of Edinburgh. It is indeed a privilege to welcome him. We had a presentation on COVID-19 about a month and a half ago by the Additional Municipal Commissioner in charge of the program, Mr. Suresh Kakani. Now, at that time, the impression was things had stabilized. Now we are finding increasing cases, not only in Mumbai, but elsewhere in Maharashtra and the country. Now, one thing this COVID-19 pandemic has highlighted is the importance of sanitation hygiene. And in this regard, I feel that particular attention is to be given to public toilets and slums and public places and to common toilets used by drivers, security staff, domestic servants, etc. in housing societies. So I would earnestly urge upon the BMC to have a general protocol issued to be followed for the day-to-day care and maintenance of these public toilets and for timely repairs. Second issue which I want to highlight is we find that every day numerous instructions are issued by various government agencies and they are changed from day to day. The common citizen is at a loss to know what the position is. So I feel that for the clarity and convenience of citizens, a single set of consolidated instructions should be issued in BMC, and these should be issued in multiple languages, issued in Marathi, Hindi, and English at least, so that the people are able to know what the systems are expected to follow. Now, another thing which is creating some kind of a anxiety is every day we are finding reports that numerous critical patients who require emergency treatment are turned away from hospitals due to the apprehension that they may be COVID positive. And generally, when a person comes for an emergency heart attack, he doesn't have a COVID positive negative certificate. So he is turned away from hospital to hospital. So my suggestion was, why can't you have an arrangement whereby in every hospital there's a holding area wherein any patient who requires emergency diagnosis and treatment can be treated with due care. And subsequently, if a COVID positive certificate comes, he can go to the appropriate center. But at least there should be a holding area where such emergency treatment given to patients without his having to be turned away from the hospital. Now, I think with these words, I will not take more of your time. I would request Dr. Deshmukh, maybe within about 8 to 10 minutes, to give his presentation. And then Dr. Shah, and then we request Dr. Gautam San as an external expert to give his advice and particularly what citizens are required to do in the present situation. Thank you.
Thank you, Mr. Ranganathan. Dr. Deshmukh and Dr. Shah, I would request you to enlighten us on a few of the points which has been much talked about and requires enlightenment by you. First of all, what is COVID appropriate behavior that as individuals we need to get used to now that we are heading for opening up more and more? The other point that has been sent to us and which definitely needs your attention and clarity in how to handle such COVID patients who are not only disabled, but also has mental retardation. Because this issue, which is extremely important, has become a major concern, especially in light of COVID wards not being able to handle such patients. So what are the protocols? It is our understanding that ICMR has issued a guidance document related to COVID and such patients. Perhaps you may touch upon that issue. Similarly, when there are COVID patients, I know that there are helplines for the emotional well-being of COVID patients who have been cured. But whilst they are undergoing treatment, there are such issues as well. So what are the protocols set in hospitals, or what directions have been given to handle those aspects too? Another very crucial issue that has been highlighted to us is a coordination between a patient's GP, especially in the case of those who are mentally retarded or have chronic issues, that the doctors in the COVID wards are different. So what is the mechanism of coordination with their own GPs? So clarity in that also would be requested. Of course, since Mr. Kakani was to be here and he also handles education department, so the point came up that municipal schools are going to open. So what is the process? Is there going to be a comprehensive health checkup, including COVID tests, etc.? So these are some of the issues which have been highlighted. And most importantly, the question comes from cooperative housing societies, that what are the rules applicable currently? As Mr. Ranganathan had said, there were so many rules that have happened, some superseded, changed, etc. It would be highly appreciated if exactly what are the rules that can be given in a comprehensive manner, so that the managing committees of housing societies are able to implement it. That would be a great support to you too. So I would request Dr. Deshmukh to start the conversation, and then followed by Dr. Shah, and then we will invite Professor Sen. Thank you. If you can keep it within about 10-15 minutes.
Okay. Can you hear me now? Very well.
Yes.
Loud and clear. Loud and clear. So I'll go ahead and give you an overview of how COVID patients are being managed in the city of Mumbai. especially in medical colleges and the major hospitals in the city of Mumbai. Now, as the patient comes to the hospital, there is a holding area, what we call as an isolation ward. In this isolation ward, there are various divisions which happen, and these divisions will divide the patients into suspects, non-suspects, and COVID positive as well as COVID negative patients. Now, these four sections within the isolation ward will identify the number of patients that keep on streaming inside the hospital. Now, once a patient comes to the casualty or the isolation ward, his entire history and his background and his family members' version is taken by the doctor who is attending the patient. Now, once the entire version, the clinical version, the social version is taken, the patient's entire treatment starts then and there. We actually do not wait for the status of the COVID report. So once he's stabilized, in the sense that when I say stabilized, it simply means that if his oxygen saturation is low, we start him on oxygen, we start him on appropriate medication, and do a COVID rapid test. Now, this rapid test, the results that we get can be had within a period of 30 minutes. Now, once we receive the reports, the patient is then directed to the appropriate isolation ward. If he comes COVID positive, he is separated into a COVID positive dedicated ward or a critical bed or an ICU, depending on his clinical condition. If he turns negative, and most of these patients who are COVID negative also come with symptoms which are similar to COVID. And here we say we have actually coined two words. One is SARI, that is severe acute respiratory infection, and the other word is ILI. It simply means that it is influenza-like symptoms. Now, these two kind of categories of patients will also have critical illness. They will also have saturation which is low. They will sometimes have acute respiratory distress in the sense that their lungs would be wanting of more oxygen. So these patients are the same except that they are COVID negative. So in a group of say 100 patients of SARI or influenza-like symptoms, almost 55% of these patients will be COVID positive. The rest of these patients will be COVID negative. This is our experience in KEM or in the major hospitals in the city of Mumbai. Now, these 45% patients who are COVID negative also need a critical bed. They also need a ventilator. They also need an oxygen bed. And once they are wheeled into a separate ward, the treatment starts from there itself. Now, once we categorize these patients into COVID positive and COVID negative, there is a group of patients who may come with symptoms which are similar to myocardial infarction, in the sense they come either with stroke, they either come with heart attack, or they come with symptoms which are mimicking embolus within the lungs, when we call as lung attack. Now, these categories of patients are stabilized first. COVID test is also done on such kind of patients, and majority of these patients also turn out to be COVID positive. The whole idea of telling you this is that any patient who doesn't have breathlessness, any patient who doesn't have fever can also be COVID positive. This is very important for the citizens of Mumbai to understand that COVID doesn't come with fever, that COVID doesn't come with cough and expectoration. COVID doesn't come only with these two symptoms or gasping for oxygen. Now, once these patients are wheeled into the dedicated COVID wards or non-COVID regions, the entire process of treatment is done by a dedicated group of intensivists, or these are physicians who are specialized into infectious diseases. Now, these infectious diseases specialists will take care of their entire protocol of treatment. Now, this protocol is all ICMR based. There is no subjectivity in the treatment of a patient, and all these ICMR related treatments are followed all over the city in Mumbai. Now, at this level, it is good to tell you that there is a task force which is there present in Maharashtra, They also guide us to the appropriate ICMR SOP for treatment of patients. Now, these patients who come with mild, moderate, or severe patients are categorized in the city of Mumbai to dedicated regions or dedicated hospitals. Now, patients who come with milder symptoms are definitely not directed towards a major hospital, but they are directed to field hospitals. Now, when I say field hospitals, it simply means that these are hospitals which are large in size. These are jumbo facilities which have been created in the city of Mumbai. The combined bed strength of these jumbo facilities, wherein mild symptomatic patients of COVID can be admitted. Now, here at these jumbo centers are scattered all over the city of Mumbai, and a combined bed strength of 6,000 plus will give us enough strength to manage patients who are COVID positive with mild symptoms. Again, the idea here is to isolate them. The idea here is to separate them from their family so that the transmission of the virus is arrested then and there. Now, once the patients who come with severe symptoms are admitted, they are away from their families. They are away from their near and dear ones. Now, the role of a doctor is not only the treatment of COVID positive patients, but it is an overall holistic approach to this disease, which is called as COVID-19. When I say holistic approach, I also mean that there will be other specialties like psychiatry, there will be other specialties like physiotherapy who will actually help the patient in combating the COVID-19 problem. Now, when I say a psychiatrist, there are certain number of patients who have deficient oxygen saturation, and these patients are more prone for psychosis. They are left alone from their family. They are alone with no social support with them. And here the psychiatrist will visit each and every patient to guide him on how to actually combat this psychosis. We have also arranged at KEM Hospital and other hospitals in Mumbai that patients who are admitted, their relatives or their relatives staying at home are contacted via a dedicated landline number from the hospital to their relatives to tell them about the well-being of patients being undertaken. Unfortunately, if a patient expires during treatment, the news is always told to the relatives from the telephone, and then they are counseled so as to their loss of to their family. Now, one more important thing which happens is these patients are bedridden for a longer period. Now, the role of physiotherapy cannot be undermined here. These are the people or these are the doctors who will help the patient in actually getting over to the physical aspect of the disease. They will see to it that they have a regular workup within the ward if possible. A slow mobilization happens within the ward itself so that the post-COVID recovery at home is much faster. When I say that post-COVID recovery, it always means that their lung capacity also needs to be built up. Their muscle tone also needs to be built up. Their stamina has to be more. So the physiotherapy gang, or what we call as the team of physiotherapists, will actually teach them how to overcome all the weaknesses associated with this illness. So,
Excellent. I mean, Dr. Deshmukh, you have given a very beautiful this thing. My simple question is by all our hospitals, if so keep getting reports, patients are turned away. Hello?
see what happens in the city of Mumbai. Initially, what we did was there was a disaster control room. So any patient who comes positive, the disaster control room will have a dashboard of beds available with them in the city of Mumbai. Over a period of time, what we did was we distributed the disaster control board into ward level war rooms. Now, at the ward level war rooms, each patient who turns positive after testing is directed to an appropriate hospital or an appropriate bed from a dedicated landline number, which a doctor himself interacts with the patient who has turned positive. He is immediately isolated to a dedicated bed, and these ward level war rooms have been very useful in actually guiding these patients. So the scarcity of beds that happened during the initial phase is no more felt right now, because the number of beds in the city of Mumbai is far exceeding the number of patients that we have right now in the city of Mumbai.
Thank you, Dr. Deshmukh. Yes, you're right. The COVID ward control rooms are very effective and very efficient. And that I say from receiving first-hand compliments from various citizen areas. Dr. Shah, would you please also elaborate whilst you speak on the issues of how the societies are to assist or to equip themselves? Please do tell us, how do you see the disabled patients who are also mentally retarded and they're hospitalized? How do such patients cope, or what is the system? Adding on to what Dr. Deshmukh has already explained to all of us.
So thank you, VCAN and Indrani and Sir Suktandar sir. I think I will throw some light on this COVID appropriate behavior. As I think we all know that on 31st of August, the government of Maharashtra issued a circular regarding mission begin again. And I think we all are aware that in a phase-wise manner, most of the restrictions are eased. The offices are open up, the malls and establishment in a phase-wise manner is opening up. The schools and colleges are going to still take time till 30th September. And of course, all our health establishments are already open. So there are various establishments and various functions in the city has now started opening up. Now, with this ease of restrictions, we have also seen that there is some kind of laxity in the people when we go on the roads, the people are not wearing masks. Number two is, a couple of times we have heard in the news that there are parties which people are arranging at homes, and there are some big gatherings also we have seen at few places. Now, let me tell you that the COVID appropriate behavior, there is a guideline where there are very simple 15 points agenda. Now, when we want to prevent, or when we say that we want to have control of COVID-19 in the city, let me tell you the responsibility as at the three levels. One is the individual level, second is at the family level, and the third is at the community or the society level. So combined together, as a citizens and as a society, we have to be responsible for our own behaviors. So it is very important that when we want to prevent this disease, so that it does not affect the most vulnerable community in our city, we need to actually behave appropriately. So what are these appropriate behaviors? One is, of course, I think most of the people know because of the news channels and because of it is so much widespread, told in the newspaper as well as in the radios and all that. But the most difficult part is to put into practice, and that is the behavior change. So we all need to now focus, how do we or people surrounding us, we try to bring in this behavior change into the people. So I would just kind of enumerate what are these appropriate behaviors, which all of you might be knowing. One is, of course, greet at a distance. Physical contact should not be there. So namaste, which is the common, now it is very famous. Maintaining a physical distance of 6 feet. Wearing a mask all the time, whether you are, in the office, or whether you are outside on the road, or whether you are shopping, etc. Maintaining a respiratory hygiene. That is also very important. Wash your hands frequently as possible. Avoid unnecessary travel. If you do not have any work outside, why you want to lingering around? So please avoid the unnecessary travel and going out of the house. Do not discriminate against some people who are COVID positive patients, and discourage the crowd. I would say that even if you are going in the malls or say for the shopping, please do not gather in very large numbers. Do not circulate some wrong social media messages or some wrong, which is not verified by the authorities. We have seen certain, WhatsApp messages which gives wrong messages about the treatment. As Dr. Deshmukh was elaborating, there are treatment protocols, there are SOPs for the treatment of COVID patients. If you circulate the wrong messages and the informations, then there is a lot of stigma and the fear which gets created in the minds of the people. Like one I said is like the test which we are doing is not good test. If you turn out to be positive, then the people will capture me and they will like kind of lock up me. No, it's not that. It is just that if you turn out to be positive, you are supposed to be home quarantine if you are asymptomatic. If you have symptoms, then you can get yourself admitted. And especially if you have, say, high risk or you have mobility, then it is for the better of your own self and your family that you get admitted. So it is very important that the fear and the stigma which is there in the minds of the people, we have to remove that, and we have to be mentally prepare ourselves that this virus is going to stay for another few 1 months or maybe year. So this is the new normal which we have to accept. Everybody will have to say that okay. I hear a lot of times that they ask me, "Oh, virus kabhi jane wala hai?" So I want to say that this is a virus. It is there in the environment. It is not going to go so fast. So we have to live and learn how to stay with the virus and how to protect our own self and our family. I would also say that please coordinate, and as Sir was, I think, pointing out, that the guidelines. There are, I think, guidelines which is available from the MOHFW website. Also, the municipal corporation, we publish the guidelines. It is available at the ward offices. There are 24 war rooms. There are helplines which are available at the war rooms. People or the citizens who want to test, they can call up and they can also get themselves tested if they want. Nearby informations of the centers they can get from there. Also, we have to also understand that if you want to keep yourself healthy, please have a healthy diet, some exercise, yoga, and stress-free life. I think it's very easy to say, but if you really want to build up your immunity, these are the basic stuff. And I think sometimes we forget what is the basics and we go into very advanced stages. So for any prevention of the disease, these are the basic stuff which we have to follow. So these are some of the COVID appropriate behavior which has been laid down by the government of India. Now, let me tell you that the government of Maharashtra and in MCGM, now we are starting a campaign which is called as My Family, My Responsibility. What do you mean by that? It means that I am responsible and I am participating as citizen of this city to ensure that this COVID appropriate behavior is being maintained by me and people around me. Plus, there will be some kind of surveys which we'll be undertaking. Also, we will want to have some kind of awareness through local groups, through our local politicians, and we all will come together and ensure that we are protected. So I would like to just sum up that COVID appropriate behavior is the responsibility of every person in the city and in the country. Now, I would just now next touch upon about the societies. I think, Madam, you asked me about the society guidelines. So let me tell you that the guidelines was published by the municipal corporation in the month of May. This guidelines is almost the same. So first and foremost is whenever there is a case in a society, let me tell you, there shouldn't be any panic. There shouldn't be any discrimination against that family or that person or the patient. This is very important. We have seen that there is a lot of panic and there is a lot of fear amongst the society members when there is डर जाते हैं. They just want to hide those. So it's very important to disclose that there is a positive case in their society. Most important question is the sealing of the societies. Now, let me tell you that we have relaxed the guidelines about the sealing. If there is a single case in one house, then only that flat or that floor is being sealed. If there are more than 5 or 6 patients has been found in one particular wing or a society, that particular wing or the society, depending on the situation, is being sealed. So it is very important that you help or you support the authorities or officers who are coming to seal the building. Number two is there are certain responsibilities on the part of the patients on the part of the family and on the part of the society themselves. The most important is the patient has two, three options. One is the home isolation. So nowadays we say that if you are asymptomatic and if you have the facilities of independent room or a toilet, you can home isolate. But especially if you are elderly, if you are comorbid, then we encourage and we really persuade the person that they should get admitted because there is a chance that this person might worsen later on. So it's very important that we home isolate the person. There are guidelines of home isolations, what the person has to do when they are home isolated. So one is the patient is home isolated, the patient doesn't have to move around in the house. He has to follow.
I think there is an issue with Dr. Shah. When she comes back, we will continue with her talk. But in the meantime, then, may I invite Professor Sen to take over. And once Dr. Shah comes back, we will switch back to her after we have finished.
Can you hear us now?
Oh, okay.
Yeah,
I was
please
about
continue.
to invite Professor Sen to start his presentation, but
Yeah, I will summarize regarding the ceiling of the buildings and the building guidelines. The recently what we are promoting is all the high risk contacts who are in the family, they should be tested.
Dr. Shah, when your line is clearer, we'll come back to you. We are not able to hear you now.
Okay.
Let me invite Professor Sen. Professor Sen, I would request you to enlighten us on a couple of the points that I thought would be most beneficial to all of us. How do you see us, since the point of immunity came up by the two doctors from MCGEM about primary care and preventive medicine? Also, what are the innovative methods for financing services to keep our citizenry, so to speak, healthy, rather than focusing on costs of treatment when it is probably too late? The other point that I would request you is that to share your thoughts, that a holistic point where, health care, as Dr. Deshmukh and Dr. Shah mentioned, about our own immunity, our healthiness, and what are the methods that you would like to share, and how healthcare providers from the public sector and the private sector can work together. Because ultimately, we have to have trust in each other. So, Professor Sen, please do share your thoughts with us. Then we will go to question answers. Many of the things will be clarified when the questions come up.
Good evening.
Professor Sen, good evening.
First of all, I must congratulate KEM and MCGM for tackling this great challenge which is facing us today. And they have tackled it very well. And I know if at all I do get any kind of symptoms of COVID, I know where to go without any fear. Having said this, let's go back to the world scenario to understand the meaning of this challenge. COVID pandemic has been a great wake-up call for whole world. At the beginning of the 21st century itself, and almost a decade before, we already knew that what are the problems facing the world in healthcare. That we cannot ignore globalization, what happens in a distant corner of the world will affect the whole world. So beautifully brought up by late Satyajit Ray's epic film, Distant Thunder, based on Bengal famine at the beginning of the last century. and which affected the whole world, and in fact started the World War I. So we cannot ignore that fact. We cannot ignore, and we have been ignoring this, and to the detriment of all of us, as it happened in the last Spanish flu, as it happened in SARS, as it happened in MERS, as it happened in H1N1 flu. It affected the whole world. So it brings out that other important issue, that we cannot build barriers, we cannot remain in isolation, howsoever important it may be, howsoever necessary it may be. But that is the band-aid solution, not the permanent solution. The other factor which also brings in that we must invest in health and education, especially for impoverished nations, that the whole focus should be on health and education, and everything else will follow. The universal health care, if you want our country to reach universal health care by 2025, as it is the desire of the government and desire of everyone all over the world, we have to go back to the basics. And the basics was there for us at the beginning of independence, during the independence, as prescribed by Sir Joseph Hoare Committee. And it stated that for an impoverished, vast population like India, if you really want to have a meaningful health care, then you have to concentrate on prevention. And the prevention at the beginning of your so-called health issues, and it should be funded, mainly funded by the government as a national health insurance, so that 15% of the population is covered as a minimum requirement. And it also prescribed that it could be delivered through the 3-tier system, which our government has done it. And since 1975, the attention was focused later on to the tertiary care. The National Health Policy of 2017 of the present government is in right direction. It has brought back the focus to the basics, and the basic is wellness and health. And it has been so very well preceded by our Prime Minister by a simple solution, which is the basic solution of Swachh Bharat. COVID-19 is not going to go away. It's going to be there for a long time. And in all probability, new viruses will come, new pandemic will come. We have to address the burning issues today, what is facing the world as well as our nation. And the burning issue is, of course, that we must invest in our health. We should rather invest in being healthy rather than being treated for illness. And the financing of the nation should be focused towards keeping the population healthy rather than just providing financial assistance at the tertiary care level when it is a diminishing return. As regards us, individual citizens, we also need to realize that our health is in our own hands. The prevention will start with ourselves. Prevention would start with your own family. And that's so important. We cannot remain in the false kind of situation when the illness strikes that someone will look after us. We cannot also remain in the false kind of uh, um, uh, cocoon that if at all the illness happens, I'm covered by the insurance. So there is a huge amount of individual responsibility, which Dr. Daksha has already mentioned. I think the public health issue and the primary care should go hand in hand, and it should be as strong and should be of high quality rather than downgraded to something which is not really required, not really responded by the public and the medical profession as such. So, what is COVID-19? As the essence of this talk today is, where do we go from here? I think the first thing which I think Dr. Deshmukh and Dr. Darsha has mentioned, that let us not be so anxious, let us not be so overreactive, let us not be so xenophobic, let us not be so afraid of COVID infection that brings about divisiveness in the society. It brings about divisiveness in our own neighborhood. It brings about divisiveness in with our neighbors. And worse, it could also bring in divisiveness in the family. So we have our responsibility is that not to get so scared away with this COVID infection, which you have already seen that it is 80% of them are mild to moderate and treatable. Having said this, now let us come to some of the issues of prevention and what you mentioned. Um, Mr. Ranganathan was mentioning that we have so many instructions coming almost every day. So I request anyone, both especially the MCGM, which is now the main institution which is tackling this challenge so well, to come together, both public and private sector health professionals, health institutions should come together. And most important is involve the community right from the beginning. That has not happened. And that has produced all the problems of so much of fear, so much of anxiety, so many people being driven away from our city because we never had them at the center of our healthcare. So please work together as a team. We are all there to look after and to face this challenge. And this challenge, which our Prime Minister had mentioned, that you have to have discipline, you have to have resolve. These are the two key words. If you have self-discipline, if you have self-resolve, that you will do and you will follow the guidelines provided so well by the MCGM and the authorities, by the government of India as well, follow them with full heart and inform these protocols to even to the community. Let them know how well organized you are. Let them have their say in this matter so that they all participate in this challenge of keeping themselves healthy rather than keeping going and running away from treatment. You have mentioned about the various tests which have come across. These tests are easily available now today, mainly because there are 3 tests, of course, as you know very well, the rapid antigen test and the RT-PCR, which are the gold standards now. The RT-PCR is the gold standard for knowing that you are suffering from COVID-19 infection. And it is, of course, it takes about 24 hours. In its place, the rapid antigen test has come. And the rapid antigen test, of course, gives you immediate answer within 10 to 15 minutes. But that it also has its own limitation. If it is positive, of course, you know that you are having COVID-19. You don't have to wait for 24 hours to get this test result. But if it is negative, it doesn't mean anything. And especially if you have symptoms, then you must have it confirmed by this gold standard test of RT-PCR. But if you don't have symptoms, of course, then leave it to the doctor, leave it to the people who know about all this. After going through the various through the proper history as the ICMR has prescribed, then you may not need further test. And the antibody test, which is there, which has a 99% positiveness and specificity, it has a tremendous value in serological survey of the population to know whether the population, how much it has spread, the COVID infection has spread in the population. But the population is also scared of this because they have never been taken into confidence. It's a different story altogether in Kerala, as you all know very well. They were there right from the beginning in the community, the healthcare workers, and they had built up that trust. There is a trust deficit today amongst different sector of healthcare providers. Please try to remove that trust deficit between public and private sector, between the healthcare workers and the community at large. You have to spread that message that COVID-19 infection is not so great, not so much to be afraid of, and you must subject yourself to the various tests which are available today, and the government is trying its best to make it easily available at a lesser cost. I'm now happy to any kind of questions.
Thank you, thank you, Professor Sen. I think we will now switch to questions because there are so many questions we may not be able to take up all. I hope Dr. Deshmukh and Dr. Daksha Shah comes back on the screen and they're able to take it. But could we start with a question as please? We have received questions on WhatsApp. We have is Facebook Live, so I'm sure there will be questions on Facebook, on our YouTube. We start with our WhatsApp questions. If we can have question 1 displayed. I don't know where, okay. When they come up, I'll ask. What should India be most worried about now that the cases are increasing rapidly at a rate of more than 90,000 cases per day? People still fear getting hospitalized for various reasons and also for social stigma. If you have the means, I think the question is related to home isolation. Is it safe to quarantine? And can two family members, if there's in the same room, but on separate beds, it's something which can come up in any society. So I was going to request if Dr. Deshmukh was going to take up this question, but I don't see Dr. Deshmukh and Dr. Shah. I think there's something, an issue with their connection. Dr. Shah, are you on the line? If you're not on the line, then may I request Professor Sen to take up this question?
Right. I think the very fact that the numbers are increasing is also suggesting that we are doing more and more testing. And the population of our country is, of course, such a vast country with so much of difference between the urban and the rural healthcare. And of course, it is spreading. But if you take the preventive actions, as I was mentioning, and if you take the key lessons, if you learn key lessons from this pandemic, and if you start initially, of course, to tackle this, which we are doing it, doing more testing and isolating people and containing the spread. But then the main issue of prevention should not be overlooked. The second aspect, what you had all mentioned, that taking whether if it's a mild or moderate kind of illness, whether we can do home quarantine. Certainly you can, provided you are properly monitored and provided there is a system by which you are monitored distantly, and of course taking care of making sure that you are not only safe for yourself but also for your family members. And of course the distancing and having a separate toilet would be preferable. And if you don't have a single room, then there is a necessity probably. And if you can, as BMC has been mentioning, they can provide a proper quarantine area where the mild cases can be kept, especially for people with lower economic kind of condition. Instead of keeping them in their own small flats or rooms where many people are there in the family, I think this is a very good movement by the BMC to provide them with a facility where they can be looked after well, even during mild and moderate illness. But this is not a long-term solution. The long-term solution is, of course, providing them a proper housing for all our service providers. Provide them with a clean drinking water, providing them with public health issues. And we have forgotten that public health is so important. And I think the attention should go back to making public health and primary care a strong healthcare service rather than downgraded service.
Thank you, Professor Sen. I think the question number 2, which had come in, has already been addressed by Dr. Deshmukh in his opening remarks. And therefore, I would ask for question number 3 to be displayed, please. I'd request the team to please put up question number 3, because that is what Dr. Shah was speaking when the signal went off. And this is related to the housing society. So Dr. Shah, if you would please elaborate on this. Have you been able to see the question?
No, can you just put it up again? Yeah.
I can I can read it out to you. Some housing societies are arbitrarily framing rules for quarantine and demanding health certificate from members if they travel within or outside Maharashtra. Can BMC please clarify quarantine rules for domestic travel within Maharashtra? Does society have any legal right to demand health certificate from members or their immediate relatives? Can society stop entry of maids, tuition teachers, service providers? Can BMC officials please clarify if any rules issued by Maharashtra government? Please elaborate on this question, because this is a very often asked question.
Yeah. So let me tell you that there are certain guidelines for the domestic and international travelers. So whenever there is a domestic travel, the person has to give an undertaking, and whenever they are landing up at the airport, they are being screened and they are being stamped. Ideally, it is advised and it is mandated that the person, whoever has traveled, has to home quarantine for 14 days. Now, there is no provision in those guidelines for the society to mandate or to produce for any certificate. Because when the travelers, they travel, there are guidelines which is laid down by the government and the state, and these are usually followed. There are some exemption guidelines which is there in certain cases when it is an official visits, or when there are visits like for the visiting the patient or a family member who are seriously ill or some is pregnant. So in these exemptions, they have to apply on the NCGM website, and these exemptions are given. So I don't think that the society people who are demanding certain certificates of the test being negative is appropriate. If at all the person himself wants to test, they can always test through the antigen test through our centers. And the second question is, I think, about restriction of the entries of the maids and the servants. Now, right now, as we are seeing that most of the restrictions are eased up, if in a particular society there is a case, that floor is sealed, not the entire society. So the members has to ensure that all the maids, all the security guards, and all other vendors who are visiting society knows the COVID appropriate behavior. You cannot restrict the entry of all these people who are coming in the society, but yes, in that particular wing or in that particular floor, the restriction has to be made. Where there is a positive case in that house, there has to be restriction of entries. But rest of the other wings, I don't think so that there are restrictions which is required. If it is declared, the society is declared by the NCGM as a containment or a sealed building, then these restrictions are there, and there are containment officers who monitors there. So I think these are my responses.
Okay, Dr. Shah, I would like to just clarify or ask you to clarify, because when you have mentioned about no restrictions, are you then saying that the society should open up completely to outsiders if there is no COVID positive case in a society? Because that is,
yeah, I think right now,
yes, because we are still officially.
I think, can I interject?
Dr. Professor Sen, just a moment. If I may request Dr. Shah to clarify from MCGM's point of view, that what is the housing society expected to do, managing committee? Are they expected to open the gates that everyone is allowed with, as you say, COVID appropriate behavior? Or are there restrictions, because officially we are still in lockdown? Because there is no particular document or rules given to the housing societies with easing up to this extent of opening all the things. So please clarify how a society managing committee is expected to behave.
So let me tell you again that there is a guideline which is issued for a society where there are the cases is found. As far as opening up for the maids, I don't think so. There are separate guidelines. You have to refer to the.
Sorry to interrupt, Dr. Shah. What I meant was not maids, because maids and domestics and drivers, that the rules are very clear. What I meant was that generally societies are restricting outside vendors from free access to societies at all times. There are certain reasonable restrictions that are put in for the safety of members. So is it that the vendors, outside vendors that is, are expected to visit societies, to the flats, etc.? Is it supposed to be opened up as yet? Because there is no such clarity from the state government as yet.
So I think
I
let
was
me
not
tell
talking
you
about
that. Okay, so I assume that most of the societies are aware that now there is opening up, and hence people have started, in fact, going to the work. So all the workplaces are open, so people have started going to their offices. Now, as far as vendors are concerned, even without COVID, there are certain societies where the vendors are not allowed to enter into the premises. They usually leave the things at the gate or at the security. I think if certain society wants to do that, that's fine. As far as those items which has been brought is reaching to a particular flats, I don't think so right now there are any guidelines which is framed by the BMC to restrict the movement of vendors. But for the sake of safety, if the society wants to do it, it's fine. But I don't think so the society guidelines has been framed in this respect. But for the sealing of buildings, once again I'm telling that the restrictions guidelines are there in place.
Okay, thank you so much for that clarification, Dr. Shah. May we have the next question, please? And I would request first Professor Sen to, I know Professor Sen was about to add to this question, but you may add it with the next one or the other. Can we have the question number 4 displayed, please? And this is to see that the tremendous constraint on the healthcare system, what measures will be taken to increase the efficiency and quality of healthcare provided in the country? And that's related to the vaccines and its distribution. So would you like to briefly tell us, Professor Sen, what your thoughts are? And then I would request Dr. Daksha Shah to elaborate.
Well, as I mentioned earlier, the vaccines are going to take some time. To get a safe vaccine which can go for the masses, it will take almost several months and may go to the end of this year or by next year. But till then, certain guidelines for ourselves, having a mask when you go out, keeping a distance, these are some of the things which has to be followed with strict discipline and self-discipline. And that's one of the things which I was saying, that any amount of rules and regulations will not work unless people understand that it is for their own good and they have some responsibility towards it. So there has to be a massive public education. For example, if you want to have your maid servant coming to you again and start working with you, and she's visiting several flats outside the your own building society, coming in, going out, and going back to her dwelling, which is usually in a slum, then you're not very sure whether she at that particular moment she is positive or negative, or she is asymptomatic. So it all depends upon your self understanding of taking care of yourself, being safe, and taking care of your family, and going through the little bit of trouble what you have to take it, and to keep yourself safe from having this kind of exposure. As regards the vaccine, as I said, it's going to be some time, but till then, what stops you from not having flu vaccine and having vaccine for your elderly parents for pneumonia? This is the flu season. These are the adult vaccination, which are compulsory in other developed world, of course, and we are still unaware about it. As you know, the flu, if you get flu, and the complications of flu could be much more serious than complication of COVID virus infection. And if there is, as you have heard, that there is the possibility of twin pandemic, Everywhere else in England, it has been made mandatory to get flu vaccination to at least minimum 75% of the population. So please go ahead and get yourself vaccinated for flu, and for your elderly parents or elderly relatives, get vaccinated for pneumonia.
Thank you, Professor Sen. Dr. Deshmukh and Dr. Shah, would you like to add to anything on this question, or shall we go to the next one?
Yeah. Can I add one line?
Yes, please.
KM Hospital has been KM Hospital has been fortunate enough to conduct the COVID Oxford trial, OVC, what we call, and the recruitment of healthy individuals is almost on. Now, this recruitment of healthy individuals has been paused for the simple reason that there was a patient with mild transverse myelitis in UK. Now, this Oxford trial, which was paused in UK, has reflected very much in India also. So today what we are seeing is that since the vaccine trial has been halted, there is probably going to be a delay, though the transverse myelitis is not a causal, has definitely not been caused by the vaccination. So unless a causal factor has been established, the vaccination will be paused.
Okay, thank you, Dr. Deshmukh. We are going to yes, Dr. Shah.
Yeah, I just want to add that we have started the vaccination in terms of the BCG vaccination. The BCG vaccine is, known to give some kind of protections from the coronavirus, and that is why to study the effect of BCG vaccine, the trial is already started in the KM hospital, where we are enrolling the senior citizens between 60 to 75 years of age. And we have completed almost more than 15 individuals of the senior citizens who have been enrolled into BCG vaccine. So if you are staying around the KM and Geek South or, Worli area, anybody, and if you wish, you are healthy, then please come forward. We have undertaken the effect of BCG and whether the BCG has any protection for the corona is being understudied. And this is under the ICMR again. KM is one of the site. So we are coordinating with the Government of India for this vaccine trial.
Okay, that's very interesting. Thank you, Dr. Shah. We were supposed to have ended at 6:30, but this is not a topic where we would like to end so quickly. So I hope, doctors, all three of you, that you may spare another half an hour at least with us. Is that okay? I hope. So we will continue with the program. Yes, thank you so much, Doctor.
Connection issues.
Yes, that's all right. So we'll carry on. There will be some technical challenges off and on. There is something which I would like to share with all our viewers, that whilst we bring all this program to you, we very much need your financial support and goodwill, and we look forward to your generous contribution to VCAN, and whatever contribution you may give will be used for the objects of the public trust and towards the corpus. You may, all donations, as I said earlier in my welcome address, is exempt from ATG. And on our portal, there is a dedicated page where all the details are mentioned. Please visit our portal and do support us so that we can bring more programs to you and help you more. Thank you. We continue with our question answers now. We have had multiple questions coming in by students, from citizens. So here's the question, which are in three parts, and I would request the first point to be taken up, the first part, by MCGM. So it is speaking about the COVID-19 spreading, that with more people being tested, there is more increase in positive cases, adding to existing numbers. And so how will it become, when and how will it become stable and show downward trends? So this is a question for both our stalwarts from the MCGM.
it is.
Yes, Dr. Shah.
Rightly said. So it is rightly, I think, observed that the more you test, the more you detect, and the more cases is going. As you are seeing in last 2 to 3 days, we are observing that the cases in Mumbai is crossing 2,000 numbers. Now, let me tell you that for any prevention or containing any virus and this kind of pandemic, it's very important. The first thing is you identify those who are infected and you quarantine them or you isolate them. Unless and until we know this person who is infected will keep on spreading the virus. So it's very important that we early diagnose and also we isolate or quarantine this person and also identify all the contacts. And these are the basic, I would say, the basic SOP of any prevention or any containment. And we call this as a chase the virus policy. So under this policy, now we have opened up, we have a universal testing policy where as much as positive is possible, the testing we are allowing. Most of the people they want to test. We have the camps, we have the testing of the commercial establishment, all our staff. Even we are encouraging that the corporates they also can test through the private labs. Wherever there are cases in those societies, also we are arranging camps. Even in the slum areas, we are arranging camps. So we are from the MCGM encouraging the testing as much as possible. The idea is you have to chase the virus, you have to identify all those who are infected, quarantine them, and timely treatment of those who require it. So I think it's very important to understand this basic and do not get afraid that how many cases have come. In fact, the more you diagnose, the more you quarantine and track, the more important is you can contain the virus. So this is the whole idea behind testing more, and do not get scared of the numbers, but look at the number of active cases. May the media must be flashing that okay, 1,50,000 cases and 1,60,000 cases, but understand that out of that, only and only 22 or 23,000 cases is at given point of time are active cases. Out of that, more than 50 to 60% cases are not having symptoms; they are asymptomatic. Those who require treatment is around say 30 to 40%, and out of that only very few are critical. So people don't have to get scared of testing. Whenever you are in contact with any positive case or a person who had cough, cold, fever, or maybe who is admitted or a known case of COVID, and then you feel that you are in contact with that person, you please get tested. An antigen test is very handy, it gives you results in half an hour. So once you get tested, you are isolated in the house. You are, if you are positive, and all your contacts are also quarantined. So definitely there may be some scare or some fear, but I think we have to overcome it. We have to say that this is for the benefit of the society at a large and for our own families. So I would just sum up that increasing numbers is going to go up. When is it going to go as a downward trend? Right now, we have to wait and watch. We cannot comment on whether it is going to decline in near future, but it will take some its own time to have that curve going down. But definitely, we are not in an exponential growth phase, but we are testing more, and that is why we are having more cases. So, you want to add something?
Thank you very much, Dr. Shah. Yes, Deshmukh.
What matters right now is we are trying to increase the denominator in the sense that once for all, if we completely test the citizens of Mumbai with a COVID antigen test, I think once everybody has been tested, it's done. So once we test everybody and the positive cases are isolated, what we can do is the remaining healthy people can definitely try and develop a natural immunity against the disease. What we are trying to do here is what is the herd immunity within the population of Mumbai. So once 60 to 70% patients are infected at a lower level, then we presume that herd immunity has already been developed. Once the herd immunity develops, I think nobody should be scared of this deadly virus.
That's very, very encouraging, Dr. Deshmukh. Thank you. Let's take some Facebook questions because we are on Facebook Live. I think there would be more questions. I know that I was going to ask Professor Sen to take up.
Indrani, I would like to take up what Mr. Ranganathan had posed this question to all of us. That We hear such a horror stories that non-COVID patients are being refused. And if you go to some of the statistics of most of the tertiary care private sector hospitals, as you know, the private sector is the major healthcare provider in the country, whether we like it or not. Most of the private sector hospitals, they say that 80%, 50% to 60% of their non-COVID cases have gone down. And initial stages, they were all refusing to all the cases which were non-COVID but coming with emergency problems like chest pain or symptoms suggestive of stroke. They were saying that get yourself tested first. And as you know, this 3 hours or 2 hours or the golden hour is so important in saving life. And if they were refusing such cases, they were also they were under scare that if they take these cases, they would be also taken to task by the authorities. So that is one of the reasons why there has to be a public involvement. We can get into this and make sure that public and private sector hospitals all come together with the public in the middle, the community in the middle of this combined effort to make sure that non-COVID cases, which are in the majority, of course, are also taken care of and support that activity. I'm quite happy that KEM hospital is doing that, but I'm not very sure that all the other hospitals are doing this. And this protocol which KEM hospital has developed has to be properly executed in all major hospitals in the city.
Thank you, Professor Sen. I think, Dr. Shah, you got your work cut out just now what Professor Sen has said. So we will work towards together to see where we can take positive steps and get to working with the system and making it more robust. Any more? We would like to take one more. There was a question on Facebook just now regarding ambulances being waiting. So I think that has already been addressed during your talks. There are more questions on Facebook. So could we have some Facebook question? Otherwise, we'll go to an SMS question. This is a question for, I think, the MCGM. Is there any issue with dead bodies in hospitals any further? There were earlier, but not now that we hear of.
So,
is there?
Can I answer this question?
Yes, please.
See, yes, please. Issues of dead bodies, yeah. There are two things which we consider here. Initially, during the early stages of the pandemic,
yes, Dr. Deshmukh. I think again there's an issue with the line. We can come back.
You hear me now?
Yes. Please continue.
Yeah. So during the initial phase of the pandemic, since the relatives and the patients were really not understanding the natural history of the pandemic, of the illness, what they were doing is they were just waiting inside the houses so as to understand that after taking paracetamol or after taking some kind of antibiotics, their cough, cold, fever will vanish. But it so happened that the oxygen saturation of these patients who were at home gradually dropped down to such drastic levels that they had to rush the patients to the hospital. Now, during the initial period, most of these patients were brought dead to the casualty in a gasping state, and sometimes they were dying within the first 24 hours of their illness within the hospital. Now, this pandemic has caused such a bad name to the hospitals which were receiving such patients, for the simple reason that the stage of the disease was so late that any kind of intervention, be it medical, be it ventilatory support, be it oxygen, but the timing of the patient reaching the hospital is very, very critical. If the patient comes to the hospital within a specified time, what we always call as the golden hour, the patient will definitely be saved. Now, during the initial phases, there were dead bodies which were piling inside all the hospitals because the influx of the dead bodies was so high and the outflux, that is disposal of dead bodies, was so slow that most of the mortuaries were not able to handle the load of dead bodies. So instead of storing these dead bodies in the mortuaries, what we were doing is we were storing them within a closed area or an enclosed area within the ward itself. Now, disposal of dead bodies to the relatives was becoming very dangerous because they are highly contagious. We did not want the relatives to get infected. Even today, the dead bodies are not handed over to the relative. It is the responsibility of the MCGM and the police department to dispose it in its rightful way. But understanding this, the number of critical patients dying right now has gone to such a low that the mortality or the fatality of this disease has definitely decreased over the last 3 months now.
Okay. Thank you very much, Dr. Deshmukh, for this clarification. Let us take one SMS question because I think this has to do with more answer from Dr. Shah because it's more of an administrative nature. This is regarding the academic and corporate spaces. So, is MCGM considering working from home now, Dr. Shah?
See, I think in the opening of we do allow certain people to work like IT related work, but in the healthcare sector, as you know, most of the doctors and nurses, they are required on site. And there is a like I have my analytic team. A lot of the boys, the children, they work from home because a lot of analytics and IT things can be done. So it depends on the situation. It depends on the type of work which they are doing. If it is possible, we allow them to work from home. Now, even in the opening of guidelines, the mission begin again, you will see that there are certain guidelines on the workplaces. Like they say that either 30 to 40%, I think it is 30%, it is said in the guidelines that the attendance should be there in the office and not more than. This is essentially to reduce the crowding into the office. So most of the offices, they can decide which kind of people, can be allowed to work from home and which is required. This will have two effects. One is in the office itself, it will reduce the crowding. Second is the commute of this person who is coming from, say, X number of, destination to the office. He will require to travel by bus or train. And right now there is, of course, we know that the trains are not to the full extent and not even the buses. So it will cut down those, burden on the essential services. So it's very important that wherever possible, people can work from, like most of the IT sector, most of the media, so many other work, can be done from home. And as we are doing right now, I think this is becoming the new normal, the seminars, the webinars, where people earlier used to travel in the conferences, in the, so telemedicine also, sir is saying. So the way we adapt more to avoid the, travel, to avoid the overcrowding, I think it's better.
That is the expected norm now. That's the trend, so to speak.
Yeah, it is, and it is up to the individual offices, and but overall, I think these guidelines are defined into appropriate behaviors also, even into the mission begin again the unlock guidelines which is there by the government.
Right. Okay, then. Thank you. Let us stay. Are there more Facebook? Have any questions come on YouTube? In case they have, because later on the questions also keep coming, so I will be sending the questions to all of you for your answers, and we can have it published. There was a WhatsApp question which also came with us that was again related to vaccine, and I think I was going to ask Professor Sen to take up this question, which is question number 7, I think, which is related to the flu shot. Of course, we have talked about the first part of the question, but the general influence of flu shot, since the pandemic is going on, would you advise that it should be taken? And if so, then what precautions should we take for our aged parents at home? Is there any relation with this? Is there anything that you would like to add to what you have already said earlier?
Well, it's been evidence-based medicine which has shown that if you have flu, then there are 6 times more risk of getting a myocardial infarction, and 8 times risk of getting a stroke. It's a well established and well published. So I think it goes by any reasoning that you should have a flu shot. As regards your elderly parents, why not have pneumonia vaccination as well? Because that's one of the way. Of course, it is not the same way which happens the pneumonia, the viral pneumonia which happens in this COVID infection. It's not the similar kind of pneumonia. It's a different pathology altogether. But then you are exposed when you are in a hospital atmosphere like KEM or any other hospital. There are hospital-acquired infections are there. So why do you have to battle in 2 fronts? You're already battling with the viral pneumonia of COVID infection. So it makes sense that not only you should have flu vaccine, you should also have pneumonia vaccine. And if the cost is the factor, which is not much, then only for people above 65, you should have pneumonia vaccination as well. The other thing which I really want to bring to notice of Dr. Deshmukh, that the people who die at the end, the relations, why do we have to be so insensitive that they are just handed over to the police and they will dispose of the body? Is there any way we can bring in the relation, keeping the distance and keeping all the precautions of safety into the picture? And what Indrani, you had mentioned earlier, it's the mental health of a person who is going there, knowing anything can happen, which is really a very scaring factor. We are the people who go there are non-medical. They don't know about 80% of them will come back and nothing will happen to them. It's all right to talk about it, but all of them are scared. And this scared have to be removed by massive public education and being very sensitive about it. And even when they become ill, seriously ill, to support them and support their family and to support the family afterwards, after their death. That's very, very important. The psychiatrists who are there, they should have outreach program to support their families who are there in their intensive care units. The physiotherapists have to go out, have to have outreach program to take care of the people who are confined in the home for home quarantine. And that can happen only if you have a robust primary care system, not downgraded primary care system, not by health posts, which are not working at all, not by municipal dispensaries, which are at times working, at times not working. Intentions are very good, but the actual action of giving all the support to the municipal dispensaries, making them robust, are not there.
Professor Sen, as you have concluded, whilst we bring this program to an end, I appeal to Dr. Shah and Dr. Deshmukh that we would like to work together to bring about a few issues which, apart from all the guidelines and all the rules, regulations that will come, COVID appropriate behavior, which in any case must happen. But as Professor Sen said, and seeing from first-hand experience, I really would like to appeal that the ICMR guidelines related to the people who are disabled and also mentally retarded, their families, their care, when it is happening in hospitals, you are already in a medical center. But when we talk about the whole families, how do we deal with it? So in whichever way we can be of assistance to work together to address many of these issues, we would really like to do that, because end of the day, it's all our lives, individually, our families, our communities. So somewhere along, we have to find the common ground and we'll need to all work together. No doubt there are many organizations who are working, but we need to coordinate and see, because, you know, mental health and emotional well-being often, if not done properly, can have detrimental effect, which is long-standing. So we need to, you know, be very also clear that who is giving the counseling, are they well equipped, are they well trained, language barriers, many of these issues will come up. Perhaps next we can have, a chat with you, Dr. Shah and Dr. Deshmukh. Dr. Shah in particular, I will be in touch with you to get from you the specific points that you would like housing societies to know, which then we can help to propagate under your, whatever you may wish to give us. We will make sure that we will, take it out, because on our portal, we have, right in the beginning, we had published a page which is on health and COVID, and links to the Government of India as well as to yourselves, all are there. So we want to make sure as much as possible we can take information to the public. Ultimately, our work is to build bridges, linkages. So we would like to do that along with you. I thank you gratefully, Dr. Deshmukh, Dr. Shah, Professor Sen, coming. And Mr. Raghunathan, if you would like to sum up, anything you would like to add, please.
See, when you are talking about mental health, this has become an important issue, not only to persons who are affected by COVID, but to citizens in general who are afraid of it. Now, traditionally in India, religion has served as a tension sink.
Yes.
If you are allowing malls, shops to open, why can't the government allow people to go to temples, mosques, gurudwaras, churches, dargahs, etc., keeping all the precautions, this thing as laid down by the government of India? I think that would give a lot of solace to people in these times when people are under a lot of tension and anxiety. But I saw a video issued by the government of Tamil Nadu where beautifully they described the processes which they will follow, so that when a person goes to a temple, adequate precautions and distancing and all is taken care of. So I think we should start thinking of doing something on those lines in Maharashtra also. Otherwise, I don't think this problem can be solved only by psychiatrists and psychologists.
Thank you, Mr. Raghunathan, for tabling a very, very crucial aspect of our well-being. Thank you so much.
Yeah, if you can open malls, there's no reason why you can't allow people to go to temples.
Well, on that note, once again, may I thank you, all our speakers, for being with us. Thank you to all our viewers, friends in the media, our team, technical team, which has worked, our social media person, Mr. Lula, and all our viewers once again. Thank you very much for being with us. Goodbye. Bye-bye.
Bye.
Thank you. Bye-bye.
Bye.
Thank you.